Good morning, students. In this lecture, we will be discussing on disaster management. These are the learning objectives. At the end of this lecture, students should be able to define disaster, list various natural and man-made disasters, describe disaster management cycle, and explain steps in disaster management. Disaster can be defined as any occurrence that causes damage, ecological disruption, loss of human life, or deterioration of health and health services on a scale sufficient to warrant an extraordinary response from outside the affected community or area. So the affected place will be in such a position they are forced to get help from outside the affected community or area. That's the definition of disaster. These are the types of disaster: natural disaster and man-made disaster. Natural disaster, as all of us know, there are so many natural disasters: volcanoes, drought, famine, earthquakes, cyclones, landslides, tsunamis, disease outbreaks, floods, snowstorms, and all. Man-made disasters, terrorist attack, warfare can be chemical, nuclear, biological warfare, accidents, riots, air pollution. Severe air pollution like smoke is also man-made. Building collapse, accidents, toxicologic accidents like a release of hazardous chemicals and substances, nuclear accident, warfare, all these things. Okay, it's clear, right? Now, these are the various biological hazards, can be epidemics. Epidemics may be the consequence of disasters of another kind. Sometimes some disasters like storms, floods, earthquakes, and droughts can lead to epidemics also. Epidemics may also attack animals, causing local economic disasters. Okay, economy is affected after biological hazards like epidemics and outbreaks. Examples: COVID, influenza, Nipah, cholera, dengue, Ebola outbreak was there recently, malaria, measles outbreak. Okay, think about current COVID outbreak, how much it is affecting the economy. Geographical disasters are there like earthquakes, tsunamis, volcanoes, drought, extreme temperature. Okay, wildfire, floods, landslide, tropical storms, hurricanes, typhoons, cyclones, all these. These are all natural geographical disasters. Technological hazards. These are some industrial accidents can also lead to disasters. Dangers originating from technological or industrial accidents, dangerous procedures which may cause the loss of life or injury, property damage, social and economic disruption, or environmental degradation. Okay. Technological disasters are non-natural. So accidental release of chemical substances during production, transportation, or handling of chemical substances. Explosions. Sometimes explosions can cause the disaster. Chemical explosions. Okay. Explosion of combustible chemical material, sometimes nuclear explosion or radiation, accidental release of radiation in civil facilities exceeding the safety levels. Internationally, some safety levels are there. This radiation or nuclear explosion happen exceeding the safety levels of radiation. Mine explosion in many areas uh, of conflict. The mines are deposited in uh, under the ground and it explodes and killing people. Pollution, degradation of one or more aspects in the environment by industrial, chemical, or biological waste from debris or man-made products, or mismanagement of natural and environmental resources. These all can lead to pollution. Acid rain, washout of excessive concentration of acidic compounds in atmosphere. Okay, so sulfur oxide and nitrogen oxides. Okay, that mix with water and result in acid rain, causing agricultural and ecological damage. Chemical pollutions. Okay, of drinking water or air near the industrial areas. Atmosphere pollution, contamination of atmosphere by quantity of large quantities of gases, solids, and radiation. Okay, so these are the various causes for disaster. Man-made disaster lead to morbidity. Some diseases and some conditions, health conditions are associated with the disaster. Okay, injuries. Disaster can lead to injuries, emotional stress. Have you heard of post-traumatic stress disorder, PTSD? Post-traumatic stress disorder that can lead to severe emotional stress. People may go to depression for a long period and may commit suicide also. Emotional stress. Epidemic of diseases. A disaster can lead to epidemics like earthquake, flood, tsunami. All these causes epidemics of diseases. Increase in indigenous diseases. Some endemic diseases can come up. You had a session on emerging and re-emerging diseases, right? Some of the diseases may re-emerge. Old diseases may re-emerge. Some of the new diseases may come up because of mutation happening because of the disaster. These are the various effects of major disaster. Okay, can lead to mortality, death, severe injuries requiring intensive treatment. Okay, so intensive care is needed, emergency care is needed, increased risk of communicable diseases. So epidemics can break out. Okay, some epidemics can happen. Damage to structure and equipments of health facility. Sometimes during war and all, hospitals may get damaged and a health facility may get attacked. Okay, so this structure and equipment. Damage to water system. Some people may attack the water system. You know what happened in Libya? Libya, some terrorist people stopped the water supply to civilians. So nowadays they are suffering that no water supply to civilians because some terrorist group went there. Unless their demand is approved, they will not allow people to get drinking water. That's it. So some man-made disasters, damage to water system happen. Sometimes chemical contamination to water system. Sometimes due to natural disaster also, earthquake and flood and all, drinking water may get contaminated. Damage to power supply. Okay, so at the time of earthquake and other major disasters, power supply get affected. It can affect vaccination and healthcare because vaccines quality will be dependent on the temperature. Okay, if power failure is there for more than 48 hours, quality of vaccines may get affected, vaccine may get damaged. So It can affect vaccination. Hmm. Food shortage. Okay, after some major disasters can affect food supply and can lead to shortage. Movement of population. Okay, population moves. At the time of disaster, some countries, people from some countries will flee to another country and as homeless, without money, without any resource. Okay, economic burden. Okay, major after major disaster, all economy is affected, and the psychological effect. As already told, serious psychological effects like depression, psychological disorder, okay, neurosis, anxiety disorder, and the economic breakdown. Okay, all these things can affect psychological uh, condition and can cause psychological effects also. Now we will go through disaster management. Disaster management is the organization and management of resources and responsibilities for dealing with all humanitarian aspects of emergencies. Okay, it's the organization and management of resources and responsibilities for dealing with all humanitarian aspects of emergencies. That's disaster management. Okay. Now, there is a disaster cycle is there. This is disaster cycle. First, disaster impact. One disaster happens. Following the disaster impact is the response. Okay, response, sudden response of the community against the disaster to save the community, to save the affected area, affected people. That's a response. Then after that, rehabilitation. Rehabilitation means bringing those affected back to the normalcy. Okay, those people are affected, so they need a physical rehabilitation. Some got physical injury and disability, so they need a physical rehabilitation. Some people lost some dear ones, so they need social rehabilitation. Okay, physical rehabilitation, social rehabilitation, and they suffered so much of psychological effects, so psychological rehabilitation. Okay, physical rehabilitation, social rehabilitation, psychological rehabilitation. And then fourth one, they got so much damage and they lost their jobs. So they need vocational rehabilitation. So they have to get trained for new job and get new job and start new job. That's a rehabilitation. So rehabilitation phase is there. Then comes reconstruction. After the disaster, so much loss happened. So reconstruction with the help of others. Non-affected people has to help and give some helping hands at the time of reconstruction. So response, rehabilitation, reconstruction. These three form the recovery phase after a disaster. Okay, this is the recovery phase. After recovery, what is happening? Next is mitigation. Mitigation means this coming back to normalcy, reconstruction, and bringing all to the normal life. Okay. Then no, then there is another phase known as disaster preparedness. Okay, so if one disaster is happening means we have to be prepared for the next disaster. So risk reduction phase before a disaster. So community, country and state involved should be prepared for a next disaster so that we can reduce the risk happened, risk to people's life, risk to people's disease condition, risk to hospital, risk to healthcare system, all can be reduced. So mitigation and preparedness are known as risk reduction. Disaster response following impact. Disaster response have some steps are there. Medical treatment for large number of casualties is likely to be needed. Okay, only after certain type of disaster. Some disaster need medical treatment of so many casualties. Most injuries are sustained during the impact and thus the greatest need for emergency care occurs in first few hours. At the time of disaster, we need emergency care physicians, emergency care nurse, emergency healthcare worker. Okay. The management of mass casualties can be divided into three. What are they? Search, rescue, first aid, triage, and stabilization of victims. Okay. First, search for people and rescue the people who need immediate recovery, immediate rescue and treatment, search and rescue them, then give first aid at that time, first aid to be given, then triage, one system of triage is kept to give care to those who can be saved. Okay, those who cannot be saved will not be given much care at that time. Why? It is not because they are not important. Giving the most resources to those who can be saved. Understood? Stabilization of victim. After saving, they should be stabilized in a hospital or in a clinic. Then hospital treatment should be there. Then redistribution of patients to other hospital if necessary. So after stabilizing, they should be moved to other hospitals in nearby areas so that they can get more care. And those who really need care can be shifted to the hospital near to the disaster site. Search and rescue, first aid. After a major disaster, the need for search, rescue, and first aid is so great that organized relief services will be able to meet only a small fraction of the demand. So there should be so many people in the field who can search, rescue the people, and give first aid. First aid is very important before taking them to hospital. So organized relief services will be able to meet only a small fraction of the demand. Most immediate help comes from uninjured survivors, those who are at the disaster site but not get injured will be the immediate help. They will help the people. They will help in searching the people. They will help in rescue the people and giving first aid. Then comes field care. Field care means what? Okay, most injured person converge spontaneously to health facilities. Okay, with whatever transport is available, regardless of the facilities operating status. Okay, so the most injured person will be taken to the immediate health facilities, nearby health facilities using the transport available. Bed availability and surgical services should be maximized. So make sure that all the beds should be ready, more theater facilities should be there, surgeons should be there, so surgical facilities should be there. Provision should be made for food and shelter of those who are getting the care. A center should be established to respond to inquiries from patients, relatives, and friends. So at that time, everyone will be panic. They will be calling and inquiring about the safety of their relatives, their friends, like that. So there should be facility to respond to inquiries. Okay, that's very important. Priority should be given to victims' identification and adequate mortuary space should be provided. Okay, so it's a very sensitive area. Field care means injured person should be taken to the immediate health facilities immediately, nearby health facilities immediately. So transport should be available. Okay, then bed availability. Nearby hospitals should have bed availability and surgical services should be made available and maximized. Then food and shelter facilities should be there. Then one center should be there to respond to inquiries from patients, relatives, and friends. They will be so worried at that time, so there should be a facility to respond to their inquiries. Priority should be given to victims' identification and a mortuary space. So there may be so many dead people, so there should be space for identification. So relatives can come and have a look and see who is there. And a mortuary space also should be provided. This field care. Then triage. Now from the field, patient is taken to the hospital. When the quantity and severity of injuries overwhelm the operative capacity of health facilities. Always health facilities are having some limitations. Okay, at the time of disaster, those who require service will be more. Number of people who require service will be higher than the health facility available. So there will be a different approach to medical treatment must be adopted. So principle of first come first treated is not followed in mass emergencies. We cannot follow the rule first come first treated. Instead of that, there is a principle known as triage. Triage means rapidly classifying the injured on the basis of severity of injuries and the likelihood of their survival with a prompt medical intervention. When a person comes, they will be classified immediately based on the severity of injuries and likelihood of survival with medical intervention. Okay, so how it is? Higher priority is given to victims whose immediate or long-term prognosis can be affected by simple intensive care. Just by giving intubation, person can survive. Okay, just giving oxygen treatment, person can survive. Just a surgical measure, bleeding can be stopped and patient can survive. So higher priority is granted to victims whose immediate or long-term prognosis can be affected by simple intensive care. You think about uh, some head injuries there. So bleeding should be stopped. Okay, bleeding neurosurgery should be done, bleeding should be stopped. Or some major injury, muscular injuries, deep muscular injuries there. So surgery can save the patient. Understood? So this one, higher priority is granted to victims whose immediate or long-term prognosis can be affected by simple intensive care. Moribund patients who require a great deal of attention with questionable benefit have lowest priority. Sometimes severe injury and patient is in major shock. Shock means hypotension is there and so weak pulse and so much in a bad state. Okay, so we give health facilities have no confidence. Even if they give so much care and attention, person may benefit or not. They are not sure. Those patients are given lowest priority. Okay, if health facilities are sure that by giving intensive treatment, patient may survive, patient may become better, then give more attention to those patients. If they are doubtful, even if with the intervention, patient may may not survive like that, that will be given least priority. Triage is the only approach that can provide maximum benefit to greatest number of injured in a major disaster situation. Okay, there are some color tagging is there. Most common classification uses internationally accepted four color code system for triage. Red indicates high priority treatment or transfer. Okay. Yellow indicates medium priority. Green indicates ambulatory patient. They can be left home. They are very safe. They can go home and take rest or take uh, minimum care. Okay. Black for dead or moribund patient. Okay. Triage should be carried out at the site of disaster. Local health workers should be taught the principles of triage as part of disaster training. These are the color coding. Black is for dead or moribund. Moribund means no least priority. Okay, red is for high priority. Immediate care and immediate transport is given to red tag because with intensive treatment, patient's prognosis is better. Black means with intensive treatment also prognosis is doubtful. Yellow can be delayed, not very serious. Can be delayed for 1 day, 2 day, 1 week also, no problem. They can be delayed treatment. Okay. So medium priority. Huh? Then minor. The minor means green color means it's a very minor injuries, so they can be sent home. They are ambulatory. All patients should be identified with a tag stating their name, age, place of origin, triage category, diagnosis, and initial treatment given. Identification of death. Okay. So taking care of the dead is an essential part of disaster management. So what all things are done? Care of the dead include removal of the dead from the disaster scene, shifting to the mortuary, identification facility. There should be facility for identification of dead body, reception of bereaved relatives. Okay, there should be some psychologists and other counselors should be there. So reception of bereaved relatives and explaining to them and consoling them. Proper respect for the dead is of great importance. Even at the time of disaster, mm, dead bodies should be given respect. Okay. Disaster response following impact. Okay. Health hazards associated with cadavers are minimal. If death results from trauma and a corpse are quite unlikely to cause outbreaks of disease such as typhoid, cholera, or plague. Okay. If it is due to trauma or injury, the health hazards are minimal. Huh? If human bodies contaminate streams, wells, or other water sources, as in floods, they may transmit various diseases like gastroenteritis, food poisoning, all to the survivors. So dead bodies represent a delicate social problem. It, it should be given respect. The bereaved relatives should be attended and consoled, and there should be facility for mortuary and identification of dead body. If it is due to trauma, not much health issues to the survivors, but if it is due to some disease or dead bodies are flowing or contaminating water bodies like streams, wells, and other water sources, as in floods, it can cause epidemic. of gastroenteritis, typhoid, or cholera, like that. Relief phase. This phase begins when assistance from outside starts to reach the disaster area. Type and quantity of humanitarian relief supplies are usually determined by two factors. One depends on type of disaster and type and quantity of supplies available locally. Type of disaster means, okay, since events have different effects on the population. Okay, so some disaster will damage all the resources in that area. Okay, sometimes supplies may be available in the area. So what supplies and what type is not available in the area, they need help from outside. Immediately following a disaster, the most critical health supplies are those needed for treating casualties and preventing spread of communicable diseases. So those are the two things needed in most of the disaster. Medicines, health supplies needed for treating casualties, and health supplies needed for preventing the spread of diseases like personal protective equipment or other protective equipment. Relief phase. Following the initial emergency phase, needed supplies will include food, blankets, clothing, shelter, sanitary equipments, sanitary engineering equipments, and construction materials. These all are needed. A rapid damage assessment must be carried out to identify need and resources. Okay. Then four principal components in managing humanitarian supplies. Acquisition of supplies. So they have to get supplies from different places in the world. Transportation of supplies from airport, from port, it should be transported to the disaster site. After that, storage of supplies. These supplies should not be damaged, and a distribution of supply. Distribution of supplies without stealing it. There are so many antisocial elements at the time of disaster. They will steal the supply. Okay, they will take the supply which is available without giving to the needy. So, acquisition of supply, transportation of supplies to the disaster site. After that, storage of supplies in the disaster site. Then distribution of supplies to the actually affected people. Then in relief phase, we have to think about the immunization. Okay, it's an absolute priority. Okay, so all children in the vaccination age group should be vaccinated. Okay, so some disaster area there should be mass vaccination should be given to all children like polio vaccination and other tetanus vaccination should be given, followed by routine vaccination. Routine vaccination means like in national immunization schedule, they have to follow. Vitamin A supplementation. Okay. All children between 8 months and 5 years of age residing in the camps should be given vitamin A supplementation along with measles vaccine, because at the time of disasters the risk of malnutrition is very high. So vitamin A supplementation is also given along with the immunization. Safe water and proper sanitation to prevent outbreaks of food poisoning and diarrheal disease. Okay, so safe water and proper sanitation should be there, and quality indicators may be set up and monitored. Okay, so chlorination should be done using bleaching powder or chlorine tablet like that. Then food and nutrition. Malnutrition is common after displacement and it can contribute to mortality also. So daily minimum of 2100 kilocalorie per day per individual should be made available during disaster time. Okay. Then shelter and site planning. Oh, okay. So there should be shelter for the people, and there should be immediate planning for stay of people. Okay. To prevent transmission of disease related to overcrowding, rain and flood and all. So shelter and site planning. Then healthcare in the emergency phase. Healthcare means it includes availability of guidelines for medical management, adequate supply of drugs, diagnostic kits, like in epidemics of coronavirus. Adequate diagnostic kits should be available, adequate medicines should be available, and adequate reagents for testing, biosafety measures, equipments, all this should be there. Control of communicable disease or epidemic. These are the various communicable disease. Waterborne diseases are there like cholera, typhoid, hepatitis A and E, okay, diarrheal diseases, vector-borne diseases like malaria, dengue, acute encephalitis, like Japanese encephalitis, because at the time of disaster, no, mosquito population will increase. So waterborne diseases will be there, vector-borne diseases because of mosquito problem, vaccine preventable diseases. Vaccination is damaged. So some vaccine preventable diseases like mumps, measles, all these things. Others like meningitis, like overcrowding will be there. So it can lead to meningococcal meningitis, leptospirosis. At the time of epidemic, at the time of disaster, there will be increase or movement of um, rat population. Okay, so that can also lead to leptospirosis. Then preventive measures. What are the preventive measures? Safe drinking water, immunization against all vaccine preventable diseases and new diseases like meningococcal meningitis, measles and all. Health department should be prepared for immunization facility. Sanitation measures, different sanitation measures, rodent control or mosquito control, because I told you leptospirosis is a problem. So rodent population will increase and move, mosquito population will increase. So there should be fogging and anti-mosquito adult measure fogging and other chemical spray should be there. Rodent means some chemicals should be used to kill and remove the rodents. Food hygiene should be maintained. Proper sewage system or disposal of excreta. At the time of disaster, there should be uh, uh, this safe sanitation facilities like disposable and movable toilets and other without causing environmental pollution. Preparedness plans for dealing with epidemics should be in place. Always think about the chance of an epidemic after the disaster. Okay. Public health surveillance to monitor health status of population. So, the same time they have to look for the problems in the community, affected community. Assessment of human health impacts of a disaster, early identification of problems to planning and effective preventive control measures. So identification of problems will help in planning. Okay, planning and effective preventive control measures. Early detection of outbreak. Okay, outbreak also should be detected early. Because, so public health surveillance system is very important. Human resources and training. Okay, health system should give more training to the human resources or healthcare resources. Healthcare workers should get training on um, disaster management, training on emergency treatment, triage, emergency management, and counseling and psychological management of people, because people are so much worried. So They need to get psychological counseling and other humanitarian approach from the health staff. Intersectoral coordination between different concerned sectors. So all sectors link together. Health sector and public works department. They are making sure that transportation is good, all the roads are in good condition, transportation and train services should be there, electricity services should be there, water quality should be maintained, water supply should be maintained, and a drainage system and sewage management should be good, media management. So there should be good communication system so that people who are lost, who are missing, their their data should be collected and their data should be communicated to their relatives. Okay, all these things. Ethics. Now we'll go through the ethics part. Disaster affected population should receive humanitarian assistance. Okay, they should be getting humanitarian service and humanitarian assistance without discrimination. And the crucial role played by women in disaster prone communities. So, no discrimination should be there. Gender discrimination or ethnic discrimination or any other discrimination. And women should be involved in disaster management activity. So, women can talk with women in a better way and they can be able to console those relatives of um, dead or diseased or missing people. Emphasis is also placed on protecting and preserving the dignity of beneficiaries. Okay, so beneficiaries will be getting the respect and dignity. Okay, so that is also very important. Particular focus has been placed on two key aspects of humanitarian action: quality, okay, ensuring minimum standard of service. Everyone will get minimum care, minimum time, and 24-hour availability. Okay, if they are calling, enquiries will be open 24 hours, and if they are coming, they will be treated well. Okay, accountability, being answerable to those who receive the assistance and those who finance it. Okay, okay, so many people will be giving assistance and help and supplies to the disaster area. So it should be accountable to how much help they receive and how much help is given to the affected population. Okay. Steps of disaster preparedness program. Disaster preparedness means after the disaster relief, they will be prepared for the next disaster. Huh? Vulnerability analysis, hazard mapping, and vulnerability assessment of buildings are done. So, how much vulnerable are the buildings and how much hazards are there in the environment? So, it may lead to next disaster. So, vulnerability analysis is done. Then, disaster mock drills like in fire drill is done here in Malaysia. Mock drills, disaster mock drill. At the time of disaster, how people will be prepared, how people will be um, um, moving and behaving like that. Training in disaster response. So police force, firefighters, social workers, local volunteers. Okay, all will be involved in training process. Police force will train how to move, how to behave during a disaster. Firefighters will help how to move with how to be safe in a disaster. Social workers will help us how to mobilize the resources at that time. local volunteers also will be involved to take appropriate action. So they will be getting training on how to do first aid, how to do triage, at the time of disaster, how to give more importance to those who may get more benefit by action. Okay, if a person's life can be saved by a surgery means he must be moved immediately to the surgical operation theater. If a person's life is in danger and doubtful, even after moving to hospital, he may not survive. It will be very difficult. It may take long treatment. Then that will be considered as moribund. Okay, they will be given least priority. That's Triage. Development of information technology. Okay, so information technology is very important. So good mobile communication should be there, good internet facilities should be there. So many disaster prone communities should have satellite telephone facilities. At the time of disaster, when all the mobile and telephone services are damaged, they can use satellite telephone service. Some countries where it is so much disaster prone, they will be having ham radio. Okay, that's one. That is like they can communicate using ham radio to different countries and different places. Immediately they can inform about tsunami, about um, earthquake and all. Huh? So they can bring the health facilities from remote areas quickly. They can mobilize health facilities through helicopter and all. Disaster mitigation. It is a community level education for preparedness to face disaster, especially in disaster prone areas. Mitigation is also like a disaster preparedness through community level education, community level training. So many people will be trained. In many areas in India, auto drivers, auto rickshaw is there. It's a like taxi, one vehicle is there. Auto rickshaw drivers are trained in first aid, so that whenever they see an accident case, they can give first aid because they are trained by government. They got certificate also. After that, they can move the patient immediately to the nearby hospital. So disaster mitigation is a community level education and training to face disaster. Disaster management committee should be there. International and voluntary agencies like Medicine Sans Frontiers, okay, Doctors Without Borders, WHO, UNICEF, all these are involved. International agencies, voluntary agencies like Red Crescent, Red Cross, mass media, training on first aid for health facilities involving hospitals, create a disaster response team. Okay, more facility information aid cells, all these things. Can this come under disaster management committee? Okay, today's session it is fully based on Park's textbook of preventive and social medicine. Okay.